Which of the following tubes should be collected first in the order of draw? A. Lavender top. B. Green top. C. Light blue top. D. Yellow SPS tube. Answer: D. The yellow SPS tube is used for blood cultures and is collected first to prevent contamination. What is the primary purpose of the tourniquet in venipuncture? A. Prevent infection. B. Slow down blood flow. C. Increase venous filling. D. Stop arterial bleeding. Answer: C. The tourniquet helps to enlarge and fill the veins, making them easier to locate and puncture. What is the maximum time a tourniquet should be left on a patient's arm? A. 1 minute. B. 2 minutes. C. 3 minutes. D. 5 minutes. Answer: A. A tourniquet should not be applied for longer than 1 minute to avoid hemoconcentration. Which additive is found in a lavender top tube? A. Sodium citrate. B. EDTA. C. Heparin. D. Sodium fluoride. Answer: B. Lavender tubes contain EDTA, an anticoagulant used primarily for hematology tests. What should be done immediately after withdrawing the needle during venipuncture? A. Label the tube. B. Apply pressure to the site. C. Shake the tube vigorously. D. Cap the needle. Answer: B. Applying pressure prevents hematoma formation and bleeding. Which vein is most commonly used for routine venipuncture? A. Brachial. B. Radial. C. Median cubital. D. Femoral. Answer: C. The median cubital vein is centrally located, prominent, and has fewer nerves, making it ideal. If a patient faints during a blood draw, what is the phlebotomist's first action? A. Finish the blood draw. B. Call for help immediately. C. Remove the needle and protect the patient from injury. D. Splash water on the patient's face. Answer: C. Remove the needle to prevent injury and assist the patient safely. What is the correct angle for needle insertion during venipuncture? A. 15 to 30 degrees. B. 45 to 60 degrees. C. 5 to 10 degrees. D. 90 degrees. Answer: A. The needle should enter the skin at a 15 to 30 degree angle to access the vein correctly. Which tube must be completely filled to maintain the correct blood-to-additive ratio? A. Lavender. B. Green. C. Light blue. D. Gray. Answer: C. Light blue tubes contain sodium citrate and must be filled entirely for coagulation tests. When should a specimen tube be labeled? A. Before collection. B. During collection. C. After the patient leaves. D. Immediately after collection in the presence of the patient. Answer: D. Labeling should occur immediately after collection, while still at the patient's side. What is the recommended antiseptic for routine blood draws? A. Alcohol, 70% isopropyl. B. Betadine. C. Hydrogen peroxide. D. Soap and water. Answer: A. 70% isopropyl alcohol is standard for cleaning the site in routine venipuncture. Which color tube is used for glucose testing? A. Red. B. Lavender. C. Gray. D. Light blue. Answer: C. Gray top tubes contain sodium fluoride and potassium oxalate, preserving glucose levels. Hemoconcentration may be caused by A. Immediately removing the tourniquet. B. Prolonged tourniquet application. C. Low needle angle. D. Using a small gauge needle. Answer B. Leaving the tourniquet on too long can concentrate cells and alter test results. What is the proper procedure for a failed venipuncture attempt? A. Keep probing with the same needle. B. Try again using the same site. C. Remove the needle and try a different site. D. Force blood into the tube. Answer C. If venipuncture fails, remove the needle and try a different site with a new needle. Which of the following is considered a critical part of patient identification? A. Asking about their last meal. B. Matching name and date of birth to the requisition. C. Asking about their medications. D. Noting what they are wearing. Answer B. Matching full name and DOB to the requisition ensures accurate patient identification. A blood culture is typically drawn to test for A. Hemoglobin levels. B. Electrolyte balance. C. Bacterial infection in the blood. D. Glucose control. Answer C. Blood cultures detect bacteria or microorganisms in the bloodstream. Which condition requires special handling of the blood sample? A. Hematoma. B. Lipemia. C. Chilling. D. Infection. Answer C. Certain tests like lactic acid require chilling the sample immediately after collection. What is the main purpose of the order of draw? A. To speed up testing. B. To improve needle efficiency. C. To prevent cross-contamination of additives. D. To reduce labeling errors. Answer C. Drawing tubes in the correct order prevents additives from contaminating other samples. What can occur if a phlebotomist shakes a blood tube vigorously? A. Nothing. B. Hemolysis. C. Coagulation. D. Clot retraction. Answer B. Vigorous shaking can rupture red blood cells, leading to hemolysis and inaccurate results. Which of the following can result in a hematoma? A. Immediate needle removal. B. Applying pressure post-draw. C. Puncturing through the vein. D. Proper anchoring of the vein. Answer C. Going through the vein can cause bleeding into tissue, forming a hematoma. Which tube is typically used for electrolyte testing? A. Lavender. B. Green. C. Light blue. D. Yellow. Answer B. Green tubes contain heparin and are used for plasma chemistry tests like electrolytes. What precaution is necessary for a patient with a known latex allergy? A. Use cotton gloves. B. Avoid alcohol swabs. C. Use latex-free tourniquet and gloves. D. Use a smaller gauge needle. Answer C. Latex-free materials must be used to avoid allergic reactions. Which of the following is an example of a pre-analytical error? A. Incorrect test result interpretation. B. Testing wrong patient. C. Delayed specimen transport. D. Faulty instrument. Answer C. Pre-analytical errors happen before testing, such as transport delays. When drawing from a patient within 4, the phlebotomist should A. Draw above the 4. B. Draw from the same arm. C. Draw below the 4, after stopping the 4 for 2 minutes. D. Never draw blood. Answer C. Draw below the 4 site after pausing the infusion to avoid dilution. Which condition can lead to hemolysis during venipuncture? A. Using a large needle. B. Gently inverting tubes. C. Drawing through a hematoma. D. Forcing blood into the tube. Answer: D. Forcing blood can break red cells and cause hemolysis. What is the proper disposal method for a used needle? A. Recap and discard in trash. B. Recap and reuse. C. Discard in a sharps container without recapping. D. Place in red biohazard bag. Answer: C. Used needles should go into a sharps container without recapping to prevent needle sticks. A capillary puncture is not recommended for which of the following? A. Neonatal bilirubin. B. Glucose testing. C. Blood cultures. D. Hemoglobin screening. Answer: C. Blood cultures require more volume and sterile conditions not suitable for capillary samples. The best site for a heel stick on an infant is A. The center of the heel. B. The arch. C. The outer edge. D. The lateral or medial plantar surface. Answer: D. The safe site is the medial or lateral sides of the heel to avoid bone damage. What should you do if the patient refuses a blood draw? A. Ignore and proceed. B. Document and notify the nurse or physician. C. Try again after a few minutes. D. Leave without telling anyone. Answer: B. Document the refusal and inform the healthcare provider promptly. Which sample must be protected from light? A. Glucose. B. Bilirubin. C. Blood culture. D. Hematocrit. Answer: B. Bilirubin is light sensitive and must be protected to prevent degradation.